Hi, good morning, Patrick. My name is Nessa Morris. I'm your invigilator for the OET speaking session on the 19th of January 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Patrick Coleman.
And what is your candidate number, please?
My candidate number is 213215930.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What is your greatest strength as a nurse?
I've been told that my greatest strength is my ability to build instant rapport with new patients. I think the way I achieve this is by applying a mix of active listening, empathy, and compassion. Once I have a full understanding of my patients' problems and needs, I put together their care plan and talk them through it, answering any questions they might have.
How would you respond if a patient wasn't satisfied with the care provided by you?
I think it's important to understand the process for handling and escalating complaints within each particular healthcare facility. It's not necessarily about trying to resolve the issue yourself, but instead, knowing when to escalate things through the appropriate chain. That way, I have a full understanding of where the line sits between me trying to resolve the issue myself or referring it to a supervisor.
What are your challenging experiences with a family?
I was once put in a situation where a patient did not want their diagnosis to be given to family members. It was a first, so I would add that to the challenges I have encountered. What I did, in that case, was to consult with the legal department if their wish could be fulfilled, if I could withhold the information. Turns out I could. However, I believe the patient should be open to their family. 2 weeks in, I learned they had informed their family.
How would you handle a disagreement with a doctor?
I had a situation while working in the ER at a small hospital. We were understaffed on certain nights, and everyone would be busy. One night, I looked over a patient's chart, and the prescription did not look right. I immediately told my supervisor. The doctor looked at the chart and confirmed that she had made an error. We were able to correct the prescription and provide the patient with the right treatment.
Describe how you manage a busy workload.
We were short-staffed on a weekend during the holiday season, and also had a higher number of patients than usual. I worried that we would have long delays in attending to our patients because of the staffing situation. I offered to stay a couple of hours longer that day, and so did some of my coworkers, to cover for the remaining shifts. Throughout the day, our team worked together and communicated with each other if we needed help or a break. Ultimately, we were able to take care of all the tasks.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hi, good morning, Nessa. I am your nurse Patrick here. How are you doing today?
Hi, good morning, nurse.
You seem to be very much disturbed. May I know what is bothering you?
Nurse, I am quite concerned about the medications. How long do I have to take these medications?
I take your point, Nessa. But, I am sorry to say that, it's not my scope of practice to determine the duration of medicine. At the same time, it's really unfortunate to tell you that you have developed urinary tract infection. But, there is nothing to get upset. You are prescribed some antibiotics to heal the infection. So you will be alright, and back to your old self soon.
Nurse, since many days I have been hospitalized. If you don't mind, can you please tell me how long I have to stay in the hospital?
Your question is totally fair. Even though it's been 4 days since you underwent the surgery, the UTI developed might cause a delay in the discharge. However, it won't take too long. Your discharge will be processed in a few days, Nessa.
All right. By the way, I would like to know whether chemotherapy is dangerous for my age.
Nessa, your question is quite reasonable, but don't worry. During every chemotherapy session you are under complete observation. At the same time, our doctors are really experts. So there is nothing to be alarmed about your chemotherapy sessions. Am I clear for you?
Yeah, all right.
Okay, Nessa, if you don't bother, may I know about your general health over the last 6 months, please?
During the past 6 months, there was nothing remarkable happened, other than an episode of unconsciousness. And also, I was not feeling well for a few months.
Oh, I see.
I also felt like I'm lacking energy and tiring quickly.
Sorry to hear that. So, may I know how you have been coping at home?
To be clear, somehow the days passed and we survived. I live with my husband, who has chronic obstructive airways disease and is partially blind. He is very reliant on me. And I live for him.
Nessa, I hear what you are saying. Please relax. Calm down. I can assure you that you will be perfectly alright and should be able to be home with your husband very soon.
Nurse, my major concern about staying in hospital is that my husband is alone at home, and he relies on me for help. Without me, he might have been struggling a lot.
I totally understand your concerns. I wish you could have disclosed your concern much earlier, so that we would have arranged a home care assistant to take care of your husband. Now, Nessa, don't be tense. I will arrange a home care assistant immediately. No more worries. Stay calm. Your husband will be assisted soon, Nessa.
Thank you, nurse. I was very worried about it.
My pleasure, Nessa. I would feel the same if I were in your situation. Now, I know how strongly you wish to be with your husband.
Yes.
Okay. For now, I will provide some diet and lifestyle changes to assist you to cope better. Hence, resulting in you being healthy with your husband after discharge.
All right, I am so glad to listen to you.
Well, I should suggest you to fill your plate with lots of fruits and vegetables instead of other stuff. You need to drink water and stay hydrated. Limit caffeine and alcohol.
Okay.
Please try with minimally processed dairy foods that are rich in calcium and vitamin D, such as plain Greek yogurt. Include whole grains. Completely stay away from excess sugar. And finally, eat small, frequent meals. Are you following me?
Yes, I am.
Great. I can also provide you with a brochure containing all the modifications required. It will be helpful for you.
So kind of you. I will definitely follow your instructions.
Good to hear that, Nessa. I wish you a speedy recovery, and hope you will be with your husband very soon.
Thank you.
You are very welcome.
That is the end of your OIT speaking roleplay. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos.
Kindly comment your suggestions and help us do better.